This is the laboratory lecture about tissues, so the histology section. These are the microscope slides that you need to be familiar with for the tissue drawings and also for exam purposes. So I'm going to go through these in the order that they're on your tissue drawing handout. And remember that assignment is worth 50 points. So make sure you get that done on time. So microscope slides that you're going to draw for the tissue drawings include these. So this is the lung right here, this slide and this slide. So this is simple squamous epithelium. And basically what you're looking at is the lining of the air sacs of the lungs. We come over here, this is simple cuboidal found in the kidney. So you can see zoomed out a little bit, you see that this cuboidal tissue is making up what we call the kidney tubules. And so you get some cross sections like this, you see some longitudinal. This is another version of simple cuboidal that's a longitudinal section. Coming over here, we have simple columnar. So if you look at the lining right here, so simple columnar, and this is found primarily in the digestive tract. And so what you'll see at the surface, which is barely visible, maybe a little bit visible here, are microvilli, which increase the surface area. You also find goblet cells in there. These are the little white dots. So goblet cells, microvilli is on the surface. So anything like that is nuclei, whatever, make sure on your tissue drawings you label those. Coming over here, this is stratified squamous. This is actually non-keratinized, and so multiple layers of cells. And we look at another view here. So same thing, outer surface flat cells, but it's many layers. So stratified squamous, and this is non-keratinized. So we'd find this in the esophagus, vagina, etc., inside of the oral cavity. So coming here, this is pseudostratified epithelium. So pseudostratified columnar epithelium. So it looks like multiple layers, but it's actually one layer of cells. And on the surface, you're going to have cilia. This is found in the respiratory tract. Same thing here. This is a good picture of it. You see the cilia on the surface. So found in the respiratory tract structures such as the trachea and other airways. Here we have transitional epithelium. So nice rounded cells on the surface. This means it's in a non-stretched out state. Same thing here. We find this in the urinary bladder. So transitional epithelium in the urinary bladder. Moving on to connective tissue, this is mesenchyme, so embryonic connective tissue. Here's one microscope slide, here's another close in, and here's another. So this is basically what you're looking for right here. This is mesenchyme, embryonic connective tissue. Over here we have 3 slides of areolar connective tissue, found all throughout the body, also the dermis of the skin. Over here we have adipose tissue, so this is fat tissue with the adipocytes and the triglycerides stored in here. This is reticular tissue, so dark stringy fibers found primarily in lymphatic organs, helping form the supporting framework called the stroma, such as the spleen. So this is dense regular connective tissue, and so parallel collagen fibers. And this is, you remember collagen fibers are strong, so we find this tissue in structures that need a lot of strength, so tendons and ligaments are the key places. Over here is dense irregular, so in this slide, this part of it, this is dermis of the skin, and then also here's a close-up which looks a little bit better. So dense irregular connective tissue, irregularly arranged collagen fibers. Big place that we have it is going to be the dermis of the skin. Here we have elastic connective tissue. So stretches with these dark wavy elastic fibers. So the primary place we have this are big blood vessels like the aorta, which blood goes into when it leaves the heart. Moving into cartilage, this is elastic cartilage. So this is probably a better view of it because you should be able to actually see the elastic fibers. Big places we have it are going to be the external ear and also the epiglottis. So elastic cartilage. This is hyaline cartilage, most common type of cartilage, also the weakest. So it should have like a glassy type appearance. So you are seeing the smoothness of it. You shouldn't see any fibers. And these are chondrocytes lying in spaces called lacunae. This is fibrocartilage, zoomed out a little bit, and this is zoomed in. And so this is the strongest type of cartilage there is. And we find this where we need lots of strength, like intervertebral disc, the pubic symphysis, also menisci of the knee. Again, you have chondrocytes lying in a lacunae, and you see the fibers, the collagen fibers. This is compact bone. Looks like concentric rings. So compact bone. These are osteocytes lying in spaces called lacunae. Come over here. This is the blood. So this is just whole blood. So all of these reddish orangish cells in the background, these are red blood cells or erythrocytes. The purple dots would be the white blood cells. We zoom in, you get a better picture. So all of these are erythrocytes. These are white blood cells known as leukocytes. And then these tiny little specks like this and like this, these are the platelets or thrombocytes. Moving into muscle, this is skeletal muscle. So the key feature of skeletal muscle is that you should see these striations in it. So you definitely see it here, you see it here. And if you look closely, you can see it in this one too. And so this is a longitudinal section of skeletal muscle. When we look at a cross section of it, it's going to look kind of like this because you're cutting across it. So it looks like a bunch of tubes. So this is a cross section of skeletal muscle. This is longitudinal section of skeletal muscle. And the microscope slides that that we're getting these from, a lot of these are coming from the tongue because you can actually see a good cross section of it. But remember, skeletal muscle is found all over the body. This is cardiac muscle. So you should also be able to see striations, which you can see right here. But the big thing about cardiac muscle is you also get these things called intercalated disc. And these are a combination of gap junctions and desmosomes that allow the cells to rapidly communicate with each other. So intercalated disc, intercalated disc. Moving into smooth muscle, specifically this is teased smooth muscle, meaning the fibers have been isolated. And so it looks like a bunch of threads. If we zoom in, we kind of see a few like this. So fusiform appearance, like fat in the middle, tapered on the ends. That's what teased smooth muscle will look like. And finishing up, we have nervous tissue. So you see a couple of neurons here, and then another one here and here. And so we call this a neuron smear because it just looks like a smear of neurons on the microscope slide. So just know this right now, this is nervous tissue. This is a neuron. And lastly, the goblet cells. So goblet cells are found in simple columnar, also pseudostratified epithelium, and they secrete mucus. So in this picture, they're the clear ovals. Those are goblet cells. We zoom in a little bit, we see here and here and here. These are big zoomed in versions of goblet cells.